Hello everyone, my name is Charles Dallaire and I'm a paramedic and clinical education coordinator for Ambulance New Brunswick. I know there is great concern with the COVID-19 situation amongst New Brunswickers. We wanted to share with you some of the measures that paramedics will be taking to be able to continue to provide necessary health care to our patients. The first step is that we will screen all patients by telephone during emergency responses through 911 to determine the possibility of exposure to the COVID-19 virus. While paramedics will continue to respond to patients experiencing significant distress, any patient with a less serious condition will be redirected to other services for assistance. These changes will help minimize the spread of the virus and ensure ambulances and emergency room services are available for persons most in need. When screening determines the possibility of exposure to COVID-19, the paramedics will be informed while en route and will arrive at your door wearing personal protective equipment to reduce exposure. The equipment includes gloves, eye protection, long-sleeve gowns, and a mask. Donning this equipment may take a minimal amount of time and will be done prior to patient contact. These steps are necessary to protect you and our paramedics. In keeping with the directive of social distancing, the paramedics may initially assess their patient from a short distance as they determine the likelihood of exposure to COVID-19. They will then perform a detailed assessment and provide treatment as required. Discussions of options with the patient, family members, or caregivers may occur based on the paramedics' findings and may include contact with an emergency physician. The goal is to address the needs of the patient and determine which patients require further medical care and which patients are better served remaining at home at rest and in self-isolation. Other options may be presented, such as contacting 811 or seeking an assessment from a family physician. In the meantime, remember there are simple things we all can do to prevent the spread of respiratory diseases. Sneeze or cough into your elbow or into tissues. Wash your hands often and for at least 20 seconds. Avoid touching your eyes, nose, or mouth with your hands. Avoid physical contact with persons suffering from respiratory illness where possible, and avoid travel. Social distancing is also key to preventing the spread of the virus. Please, please stay home if you possibly can. Following these steps will make a big contribution to flattening the curve of this virus. This, in turn, will absolutely save lives. It is our responsibility and privilege to care for the patients in our communities. Paramedics will always be ready and willing to respond to your urgent medical needs. Thank you.